Anticholinergics are used to relax the bladder and improve bladder storage. An example of this type of drug would be oxybutynin. Anticholinergic side effects include blurry vision, urinary retention, dry mouth, and constipation. These are going to be worse in elderly patients. Anticholinergics are useful for overactive bladder, urge incontinence, and painful bladder syndrome. Alpha adrenergic blockers end in OSIN, so think tamsulosin. These are used to treat urinary retention by relaxing the urinary muscles and the ureters. This is useful with stones and BPH. Alpha adrenergic blockers like tamsulosin can help with all stones by relaxing the muscles to promote the passage of the stone. Potassium citrate alkalizes the urine and can be helpful with all stone types except struvite. Allopurinol is helpful with uric acid stones because it reduces the uric acid levels. The specific medication used to treat a UTI is going to depend on the type of the UTI. Some things that I want to point out is that macrobid, nitrofurantoin, teach the patient that it turns the urine dark yellow or brown. And then also with Bactrim. An ingredient of Bactrim is sulfa, and sulfa is a common allergy, so make sure you pay attention to that anytime you give that drug. A common side effect of antibiotics is diarrhea, and giving a probiotic 2 hours after an antibiotic can help prevent this. What medication interactions should be considered? We need to consider the timing of antacids. We need to give antacids either 2 hours before or 2 hours after the antibiotics. Urinary analgesics treat dysuria. Those have the common word part of AZO. Remember to educate your patient that it will turn their urine orange or red, and it will stain any clothing or fabrics. Calcium glycerophosphate is the over-the-counter drug that decreases pain and irritation to the urinary tract and the bladder. It works by alkalizing the urine. So your patient would take this before they consume any foods or beverages that might be irritating to the bladder.